Good day everyone, this is Mary Rose Garcia, a secondary nursing student from Section 1 in Back. So for today's video, I'm going to perform an administration of oral medications. Oral medication, it is a procedure wherein we are giving medications to be swallowed through the mouth. For the assessment, first we have to assess the appropriateness of the drug for the patient. Review medical history, allergy, assessment, and laboratory data that may influence drug administration. Assess the patient's ability to swallow medication. Verify the patient's name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. If the medication may affect the patient's vital signs, assess them before administration. If the medication is for pain relief, assess the patient's pain level before and after administration. To ensure that patient metabolizes medication without feeling of nausea or vomiting. To offer the most common, easier, and least expensive route of administering medication. To provide a sustained drug action and increase absorption time. Some liquid medication preparations such as suspensions require agitation to ensure even distribution of medication in the solution. Be familiar with the specific requirements for medications you are administering. Medications intended for sublingual absorption should be placed under the patient's tongue. Instruct the patient to allow the medication to dissolve completely. Reinforce the importance of not swallowing the medication tablet. Some oral medications are provided in powdered forms. Verify the correct liquid to dissolve the medication in for administration. If the patient's level of consciousness is altered or his or her swallowing is impaired, check with the physician to clarify the route of administration or alternative forms of medication. Tablet and capsules are given with water to prevent antagonism of chemical properties of the drug. Cough syrups and antacids are not followed by water because they dilute the topical effect. Crash pills or liquid may be mixed with a small quantity of bland food, if not contraindicated by patient's diet. Pediatric oral medication may be given by dropper method depending on the age. Let the medicine flow by the cheeks to prevent danger of aspiration. Pediatric medications may taste unpleasant to the child. Administering it may need to have its taste disguised. If patient's intake is being measured, record the amount of fluid that was taken with the medicine. Drugs that discolor the teeth or tend to damage the enamel should be given well diluted and should be taken through a drinking straw. Reconstituted medicines, especially antibiotic, have to be stored in the refrigerator to maintain its potency. Soft foods can be a vehicle for pills, tablet, or capsules, especially for persons who find them difficult to swallow. Lastly is to monitor reaction of the patient to medication administered and document. For the equipment, we need to have medication in disposable cup or oral syringe, liquid with straw if not contraindicated to the patient, medication card or tray, and medication card. Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies and check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication order for each agency. Note the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient and perform hand hygiene. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Hand hygiene deters the spread of microorganisms. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Good day, mate. I'm your nurse for today. My name is Garcia. Can I ask what's your name, please? Identify the patient by checking the name or identification band or ask the patient to state his or her name. This could ensure the right patient receives the medication and help prevent errors. Explain procedure to the patient to gain cooperation and to allay anxiety. Assist the patient to an upright or lateral position to facilitate proper positioning for swallowing and to protect the patient from aspiration. Okay, mates, we're here for medication and your water. Offering water with medication facilitates swallowing of solid drugs. So when taking your medication, miss, what do you prefer? Do you prefer to take it by hand or in a cup? Okay. Asking patients' preferences could encourage participation in taking medications. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Unless the nurse has seen the patient swallow the drug cannot be recorded as administered. The patient's chart is a legal record. Only with the physician's order can medications be left at the bedside. Perform hand hygiene to prevent the spread of microorganisms. Leave the patient in its comfortable position. After that, we have to check the patient within 30 minutes or time appropriate for drugs to verify response to medication. This provides the opportunity for further documentation and additional assessment of effectiveness of pain relief and adverse effects of medications. Always record the date and time of administration, name of drug, dosage amount and frequency, route of administration, and signature of nurse administering the drug. For the evaluation, patient will be able to ingest and metabolize medication without the feeling of nausea or vomiting. Patient emotionally accepts medication. Desired therapeutic effect is obtained. Experiences no adverse effects including allergy response, systemic effect, or injury. So that will be all. Again, this is Garcia, a second-year nursing student from Section 1 in Garcia. Thank you and God bless us all.